Everybody, in a newer little location here. Same me, new room. Anyways, we won't talk about that. A little bit of a grind, but it's done. Hope everybody's doing well. Happy Pharmageddon Day 1. It's Monday, October 30th. That's what we're talking about today. Let's do it. Cool. So good evening, beautiful souls and curious minds. I'm Dr. Joaquin Acosta, your host for tonight's enlightening journey on the Know Your Pharmacist livestream. Also, the proud CEO of Pharmatree, guys. Tonight, we are delving into a crucial narrative unraveling in our pharmacy landscapes, dubbed as Pharmageddon. As CVS, Walgreens, and Rite Aid staff champion for fair work conditions, we unfold the implications of this collective action, shedding light on a critical turning point that began in Kansas City. As we navigate through these tides, we'll also explore a heartfelt initiative by High Horse Cannabis Company, supporting a bud tender in need through a savory brisket fundraiser this coming Thursday in Las Cruces. The essence of community shines bright, echoing the resilient spirit that binds us. Furthermore, we'll delve into the mental health dynamics among healthcare workers, a pressing concern unveiled in a recent CDC release. Our quest for knowledge continues as we venture into herbal realms, investigating cannabis's potential role among nursing professionals and its status in the federal schedule. Our segments will not only inform but provoke thought, igniting a collaborative discourse that bridges science with the heartbeats of our community. Tonight, we bind the threads of competence and compassion, weaving a narrative that not only educates, but resonates with the core of human empathy. The engagement doesn't end here, guys. Every insight shared, every question raised fuels our communal enlightenment, fostering a space where curiosity meets wisdom. Together, let's not just learn, but evolve as we transcend the conventional, making each dialogue a stepping stone towards a healthier, informed, and more harmonious society. Huge shout out to our invaluable show sponsors, Pharmatree, High Horse Cannabis Company, Vado Speedway Park, and the Baked Chicken Farm, who fortify this platform, allowing us to dive deep into topics that matter. Your support is the wind beneath our wings. Now, without further ado, let's embark on this captivating expedition, guys. Jump on in, talk to us, Pharmageddon, if you're participating, if you know anybody that's participating. I know we can't necessarily disclose names or who is and what is, but things are happening right now. You know, if you're on vacation right now in the pharmacy industry, highly support it because, again, especially if you're working for Walgreens or CVS right now, you may be actually helping to contribute to Pharmageddon Day 1. So again, Pharmageddon Day 1, what is this, everybody? Back in September, pharmacists from CVS and Walgreens, specifically starting with CVS, staged a walkout basically because of working conditions. They were getting too insane. And already as you start looking into the flu season and metrics and vaccines and the whole thing, guys, all of a sudden, you've been seeing a lot of patient care just go down, the toilet as we are seeing our big chains continue to seek profits over patients. And our pharmacists have had enough. And that's what is the good news here. But because their jobs are on the line, their livelihoods are on the line, their salaries, everything that goes in with this, the voices of our pharmacists are not being captured very well because if you speak out, all of a sudden, Walgreens had already rumored to be reprimanding and no raises for anybody who participates in the walkouts. Participating in the walkout could be just calling in sick on the days during Pharmageddon, Monday through Wednesday this week. And this is, again, a response to the fact that nothing changed after the pharmacists went and stuck their careers and their licenses out there in Kansas City back, in September. So now we're at the end of October, and again, it's round 2. So end of September was in the Kansas City walkout. Walgreens walkout was October 10th-ish, around that time. And now Again, everybody is going for the 3-day walkout. Rite Aid was having some walkouts in the midst of that, as well as Kaiser Permanente. But the story continues, and that's what's important, guys, because pharmacists do not feel heard. And I mean, for us to literally sit there and not really recognize what's going on, it may go in the media for a headline for a day, but because it can just go in the media for a headline for a day and then get swept under the rug, there's not a lot of work being done in the interim, and AKA that's between your corporate, teams over there at Walgreens and CVS, and again, the actual pharmacy employees who are working to, yes, try to help deliver patient care in the best possible way without sacrificing their licenses, without sacrificing anybody else's health. And, let me read this response here from the American Pharmacist Association. I actually do appreciate this here because they had been pretty silent about this. And finally, the American Pharmacist Association CEO put out a statement here, and I really appreciate it and want to commend it. So if you guys aren't following the Accidental Pharmacist on Facebook, Shane Jeromowski, he's the guy that's really leading a lot of this, unionizing to whatever degree that is here for the pharmacy teams coming together all around. And he's been doing this for a while. Anyways, reading from here, APHA stands with every pharmacist who participated in the walkout today. Bottom line is that we support every pharmacist's right to work in an environment with staffing that supports your ability to provide patient care. We know that these are steps you deem necessary in order to be heard by your employer. For years, you have dealt with workplace issues leading to frustrations and burnout, affecting your mental health and well-being. I have traveled regularly since my tenure as APHA CEO began last summer, and I have seen the burnout and frustration firsthand. While today Walgreens and CVS pharmacies are the focus of attention, I've also seen and heard clearly that corporate chain pharmacies are not the only place where pharmacists are being asked to work without adequate staff. I've heard from pharmacists in hospital outpatient pharmacies, federal facilities, and mail facilities about the same burnout from inadequate staffing. Inadequate staffing is unacceptable in any setting. In many ways, the recent headline of the USA Today story is true. Our pharmacy system is broken. For far too long, employers have made this situation worse than it needed to be. Supervisors who are not pharmacists do not understand the needs of care teams and make unreasonable demands on time-based productivity. Quotas on the numbers of prescriptions filled per hour, or vaccines administered per day, or even time to answer the phone simply fail to recognize that the pharmacist-patient relationship is not transactional. It's a special covenant, and supervisors who distill everything down to numbers and time metrics are destroying that relationship in the name of profitability. Ooh, that gives me the chills. This must stop immediately. Employers should ensure supervisors clearly understand the covenantal pharmacist-patient relationship and that systems support this relationship fully. I again call on all employers to act swiftly on these issues that your pharmacy staff has made clear that that they will no longer tolerate. The industry needs to come to long-term solutions, and we need immediate action. I'm also calling on CVS Caremark, Express Scripts, Optum, and all other PBM companies to immediately cease the assessment of DIR fees on retail prescriptions and ensure your contracts result in payment to pharmacies of at least their cost for the medicine they are providing plus a reasonable fee for doing so. This is a statement to protect independent pharmacies, the ones who are serving the communities where pharmacy deserts are starting to appear. Again, independent pharmacies, it's a big deal. So also, you are breaking the backs of community pharmacies and are ultimately complicit in the workplace issues I am describing. Your corporate policies are unfair, restrict trade, and are causing the closure of hundreds of pharmacies across America. You are worsening health disparities and creating a new public health emergency. Soon there will be no pharmacies. chain or independent in most communities to administer vaccines or provide testing for infectious disease. APHA shared the learnings from the first-person experiences of pharmacists and pharmacy personnel from the Pharmacy Workplace and Wellbeing reporting tool with chain community pharmacy employers. The quarterly learnings from real-life pharmacy experiences paint a grim picture of workplace conditions, which is unfortunately nothing new. As documented in the just released 2023 third quarter report, submissions indicated that workplace conditions continue to be the primary reason for negative experiences, and that the inadequate staffing, which leads to increased workload and puts patient safety at risk. And metrics are the two leading causes of pharmacist burnout. Furthermore, the CDC has released the results of a recent survey which shows the incidence of harassment from patients toward healthcare workers have more than doubled from 2018 to 2022. It also tells us that 46% of healthcare workers reported feeling burnt out, up from 32% in 2018. Total of 44% of healthcare workers in the same survey said they would be looking for a new job. So again, guys, let's segue into the survey, right? Because it's important. So look, from the CDC newsroom, this is literally recent as of this week. And this is why I actually do applaud the APHA CEO for even citing this as well, because this is part of, the pharmacist's duty to even cite your work, right? What studies show, things that you're saying, right? So what makes it valid? Healthcare workers report harassment, symptoms of poor mental health, and difficult working conditions, right? Literally, CDC reports 85% of healthcare workers did experience harassment. Reporting feelings of anxiety, 60% reporting feelings of depression, 81% reporting feelings of burnout, right? And we're looking at this because the healthcare industry as a whole is suffering. But again, the pharmacy industry right now is really exposed. And guys, it's been that way for a while. So again, this is why we're here. So the CDC page here, CDC's vital signs report, health worker burnout was at a crisis levels prior to the 2019 pandemic. They were already tightening it up, for metrics and profitability before then. And again, metrics and profitability is a volume game in the pharmacy industry. And when the ones that are controlling the absolute volume there are the ones that are, again, creating the metrics as well, you have the giant volume of people that suffers. Everybody in the blanket of Walgreens and CVS of their patient care is suffering from the fact that they're doing this, right? Burning out every single one of their employees, letting them walk. And it's not okay. And that's why we're here, to continue to show that. It just doesn't make any sense. So I'm going to show you guys a little video here, skipping back and forth.
Announced plans to close hundreds of stores. And at many of the remaining locations, pharmacy workers say working conditions have gotten worse. That's led to unannounced walkouts, and this coming week, a planned walkout at Walgreens nationwide. Tom Murphy is the Associated Press national health writer. Tom, I know you've been talking to pharmacists at Walgreens and elsewhere. What are they telling you about why they're taking these job actions?
Well, the biggest thing they're stressing is this isn't about money. They're not seeking more pay. They just need more help behind the counter. That's what they tell me. They've been stressed, especially by all the vaccines they have to give now, especially in the fall when you have COVID shots and flu shots and pneumonia vaccines coming into your store every day. They want more help behind the counter because they said their main job is obviously filling and checking prescriptions. And every time you have to break away from that to do a vaccine, it's putting more stress on your main job. A lot of times, there's only one pharmacist behind the counter and they can't break away for a bathroom break, or the pharmacy has to close. They're also being asked to do a lot more with healthcare. A lot of them help people quit smoking or monitor their blood sugar. So they need help with these tasks in order to do their main job, which is filling prescriptions and checking them for accuracy. Chain stores tend to operate with one pharmacist on duty instead of having overlapping shifts or multiple pharmacists on duty. And that means the pharmacist can't leave the counter because you can't operate a pharmacy without a pharmacist on duty.
And what do the chain stores say in response to this?
They say they are listening to their concerns. Walgreens, for instance, has opened a bunch of processing centers around the country to process a lot of the chronic prescriptions that patients get regularly, which will take workload off the store pharmacists. CVS is doing some things too, but so far the pharmacists haven't seen enough to alleviate their concerns.
How much is the changing economics of the pharmacy industry? I mean, we've seen sort of great expansion, now retraction, the rise of pharmacy by mail. How much of that has led to these problems?
All those factors have definitely contributed to the problems. The biggest one is pharmacies just don't get a lot of money for the prescriptions they fill, so they're left with what's called a thin margin. So they have to make money elsewhere, and vaccines can be a little bit lucrative for them. Their other problem is that they added a lot of stores 15, 20 years ago to get closer to the consumer. And then Amazon got much closer to the consumer and is taking business away from what's called the front of their stores, which is the area outside the pharmacy where a lot of their consumer goods are sold.
And what's the effect on the consumer of all of this?
Well, with the consumer, there can be really long waits for prescriptions. You could come into the drugstore and find that the drugstore is temporarily closed because there isn't a pharmacist on duty. It also exacerbates problems with drug shortages. I had a pharmacist tell me that one day last fall, he took 100 phone calls during the day just for shortages of amoxicillin and Adderall.
With so many physical stores closing, are we in danger of having regions or neighborhoods where there's just no nearby pharmacy?
That's always a risk, especially in poorer neighborhoods that have a lot of Medicaid patients, because they just don't make a lot of money for the drugstores. So financially, it might not make much sense for the drugstores to stay open in some of those neighborhoods.
And what about rural areas? Are there concerns about pharmacies disappearing in rural areas?
Yeah, it's a different dynamic. Instead of a drugstore being a few blocks away, a pharmacy desert in rural areas is considered a drugstore that's maybe 5 miles away. But that is a problem, and Rite Aid was actually trying to address it earlier this year with a really small program where they opened mini stores in so-called pharmacy deserts, in areas where there aren't a lot of pharmacies.
You mentioned Walgreens setting up these distribution centers to handle a lot of the prescriptions. Is it getting to the point where we really don't need a brick and mortar pharmacy?
Not quite, because pharmacists play a really valuable role in talking to people about their medicines.
Quite the opposite.
And making sure that they have the right dose, or talking to them about side effects and how to manage those, or just seeing how they're feeling. And if you're at a processing center filling a prescription and not talking to the customer, you lose that. So there's still a lot of value for those brick and mortar stores.
Tom Murphy of the Associated Press, thank you very much.
Thanks for having me. I appreciate it.
Almost 500,000 pharmacists, and most of them right now are pretty ticked off, guys. And that's pretty much, mute point. Pharmageddon day one, again, Kansas City walkouts from CVS started in September, and now we're at the end of October with the third round of walkouts that we're on right now. You're seeing healthcare walkouts, pharmacists walking out, leaving their stores, technicians again as well. It sucks that this has to be that way, but they are not being heard. They are fighting, literally running very, very risky operations for basically nothing. And that's what's happening. So, guys, I'm going to segue on. Let's talk about our Herbal Wellness Corner, because this is an important topic. I think I wanted to make sure that we get brought up as well, because granted, this study got brought up 2 years ago, and the results of it aren't out yet, but the University of Arizona College of Nursing, their health sciences were to study the impact of nurse cannabis and substance use on patient care and how that works. Interestingly enough, right, because when you're looking at mental health and things like that, again, cannabis can be such a healing substance, and we don't really have too many great bits of information to tell us how healthcare providers, should be, tested for it or not. Again, here in the state of New Mexico, if your institution allows it in their workplace policies, you're okay to use cannabis. However, again, as part of your license, you're not to be inebriated under your license. So the definition of inebriated in that part is probably where it gets hairy, where you see companies like Walgreens or CVS not allowing their pharmacists to use cannabis on the job yet right now in New Mexico, when New Mexico, it's legal state to do so, right? Granted, cannabis is federally a Schedule 1 controlled substance, but would it make a lot more sense maybe if your healthcare providers were a little bit more able to be relaxed, right? When we're looking at in our Enlightenment hours, we just showed, and I'm going to just flash back to that again, healthcare workers reporting harassment, symptoms of poor mental health, and difficult working conditions, where healthcare workers are reporting feelings of anxiety, depression, and burnout. And this was trending to an all-time high before COVID, guys, before COVID-19. And now since COVID-19, it's just out of control, right? Because trying to normalize on top of all that, created this situation that we're in. And then boom, all of that is there, and we're restricting our healthcare providers from being able to, use medicine that nature provides. But, alcohol theoretically is okay. Granted, right? You don't do it at work, these things. But we know what people come home and they're on pain and they want to relax and they open up a drink or whatever it is or go to the bar. You're allowed to do that and work for a hospital. You're allowed to do that and work for CVS or Walgreens. You can get as boozed up as you want, go buy booze right out of the liquor aisle in Walgreens, hooch your way out into, wherever, show up to work the next day and be ready to go. And, theoretically, you're not breaking any laws. Is it the best? No, not at all. But again, it's an important topic and it's worth ranting because people do not understand where we are at right now. And we really do want to advocate for our healthcare providers to be able to acknowledge their mental health and heal themselves in whatever way that it should be. Look in here, the University of Arizona, guys, I want to share this video so you can look at the study. Let's look.
Welcome back. Now that 47 states have some form of legalized medical marijuana, it's estimated 3 million Americans use cannabis for illness relief. Many of them are healthcare workers and nurses.
A new study completed by the University of Arizona College of Nursing takes a closer look at the information behind the numbers of those in healthcare using cannabis and other substances. As KLD News 13's Meg McNeil explains, it often has something to do with the nature of work.
Long shifts, sick patients, and a pandemic to top it. All forces adding physical and mental stressors on healthcare workers. Many have talked about COVID and compassion fatigue.
COVID fatigue and compassion fatigue are very real.
Concept of fatigue is experienced every day by our healthcare workers, our public health workers, I would say by our frontline workers.
A recent CDC study found more than 50% of healthcare workers reported at least one mental health condition, like anxiety or depression. Sadly, nearly 9% reported having suicidal thoughts.
Our frontline healthcare heroes have been at this now for over a year and a half.
Now, researchers at the University of Arizona College of Nursing are looking into how nurses cope with the mental and physical pain of the job, specifically when it comes to cannabis and substance use.
Thinking about what are the things that are impacting nurses' health and safety that is leading them to use substances? And is there a way that we can develop interventions within the work system to address some of those issues?
Early findings of the 2-year study show nurses were using coping mechanisms like cannabis after work.
We really found that nurses were doing these things to recuperate after work. So they were coming home from work, they were in a lot of pain. And so then they were using these different coping strategies rather than using them prior to work.
The study aims to find out how often and why nurses are turning to cannabis and other substances. The findings could help improve work conditions or help the state boards of nursing reconsider recommendations when it comes to substances and work environments.
So there hasn't really been a big study of nurse cannabis use since cannabis became legal in so many states within the United States. So I think that's why it's such a regulatory issue for them, is they're having their state boards of nursing ask, well, what should we be doing in this space?
If they can help find the root cause in a work environment, it may help nurses' physical and mental health in a time it is so desperately needed. Megan McNeil, KOLD News 13.
The study will also look into the effects on patient care.
So anyways, food for thought. I mean, our healthcare workers do so much, and I could just think, and this isn't something to laugh about or make a joke about, but again, if you actually did have some of your healthcare workers that were able to unwind, with a healing, substance such as cannabis, would it really be that big of a deal? Would you actually even be going through Pharmageddon right now? A really good question, right? I mean, again, there's this entire situation that, is going to continue to unpack itself each and every single day. And the best that we can do is really just continue to advocate and try to, be here for the cause. That is truly it. Guys, moving on to our community spotlight here in my description here for the live stream today, you should be able to see the details as well. But I'm going to share with you, again, Thursday, November 2nd, we've got brisket plates on sale. So that's already coming up by this Thursday. But really good cause here for High Horse Cannabis Company. Again, one of our employees had their car stolen, as well as some really important equipment that they needed to do their side gig, which is barbering, and their barber equipment was also stolen with the car. And I really appreciate my workplace for helping to take care of all of our employees, and this would really help one of our staff members who really got hit and affected hard by that. So if you see the corner number at the bottom, you can order by texting that number at the bottom. There's the pickup, $12 a plate, and go get you a plate for a good cause. All right. So lastly, Men's Health Minute. Let's cue this up real quick. Conversation overdue. Erectile dysfunction and low testosterone offer a gateway to men's health. So a conversation I think is important to bring up, guys, because again, when men will go to the doctor, whether or not you've actually broken a bone, the other two times are for, erectile dysfunction and low testosterone. So again, what does that really mean? If you're a man, or even a female that's got a man in your life, this may be a good avenue for you to get your companion over to the doctor's office. Maybe take care of something to, a man that may think is a more important health concern to take care of, and doctors will do a really good job at going to sift through the rest. So that's kind of my little bit of advice today here, right, guys, where you think, again, maybe what erectile dysfunction or what low testosterone could be other symptoms of, or what else could be going on. That's the point, right? So here, the Kevin Billups, the director of Men's Health and Vitality Program back in 2014 over here at John Hopkins Memorial, basically saying, generally, ED and low testosterone are not all he's treating. The first thing he does is point out that the problems do not occur in just a vacuum. What else is going on, right? For example, if a man between 40 and 50 has ED, growing evidence suggests that he could have nearly 50-fold increased risk of developing heart disease in the next 10 years. Billups also refers many of his patients to general urologists, primary care physicians, sleep specialists, or preventative cardiologists for further testing when needed. So very nice to have that integrated multidisciplinary care. And maybe we don't always have that top-down system here in Las Cruces, New Mexico, available in that particular avenue or fashion. But, All I'm saying is, if you need a reason to get your man to go to the doctor because, men are struggling, getting outlived by women by at least 7 years right now, because, we do not go to the doctor until it's too late, and we're notorious for it. The stats convey it, and that's that. So hope everybody's had a good rest of their day. First Monday back, October 30th, broadcasting from the room. Shoot me some questions if you need them. I'll get back to you when I can, and otherwise